Hello, my name is Josia. I am an MBA student from Institute Technology Bandung. Today, I would like to explain about the globalization of the pharmaceutical industry case study. In the past decade, there are so many of large pharmacy companies were merged each other. The largest merger was Pfizer acquisition of Pharmacia for $60 billion in 2001. Pfizer is the largest drugstore company in the world and Pharmacia is the 8th largest. Indeed, all of the world's 10 largest pharmaceutical companies have been the result of one or more mergers. The only exception is Merck, the 4th largest company in the world. Still, the top 12 pharmacy companies control less than 50% of total world drug sales. And so, there still seems to be a great of room for further merger in the industry in the future. There are three major reasons for the urge to merge in the pharmacy industry. The first and the most important reason is the incredibly high cost of developing and marketing new drugs. Although the average profit rate about 15%, the development cost was still huge, even for the greatest pharmacy company. The second reason is that management typically expect saving equivalent to 10% of the combined sales of the merged company. The third reason is that the combined sales force of the merged company can increase market penetration ability by reach many more doctors and hospitals that will increase drug sales. Although according to theory, the merger will give a good benefit to the companies, but the reality, most mergers in the pharmacy industry didn't deliver the benefit that expected. In all cases, the merged company lost market share and faced reduced profit after the merger. All companies now face very strong competition from generic drugs. As patent expire on many blockbuster drugs, you may ask why does a drug's market exclusivity period matter at all? Since drugs are covered under patent protection for a period of 20 years, the problem arises because the FDA usually does not approve a drug from sale and usage until several years after the patent has been granted. How big will the savings be if generic copies can be made of patented biological drugs? Biological copies of generic drugs are called biosimilar, not biologic generic because it's difficult to make an exact copy of a biologic drug. Remember that biologic drugs are made from live cells, and that means it is virtually impossible for a similar version thereof to be exactly the same. Because even small change might affect a drug's safety or interaction. Biosimilar drugs would have to undergo their own expensive testing and not be able to rely on the test as is done on small molecule pills. Since this can be a very costly process, it is estimated that biosimilar drugs could be sold at only about 25% discount to the patent version of the drug. In Europe, which has approved biosimilar version of 3 biological drugs, companies have priced the drugs at only a 20 to 30% lower price than a patented version on the drugs. By 2005, about 50% of all prescriptions were filled by generic drugs. This number was increasing from 20% in 1984 in the United States. The pharmacy industry could be classified as oligopoly market, which there are few sellers of homogeneous or differentiated products. There are 4 reasons why pharmaceutical industry were categorized as oligopoly, such as: first, economy of scale may operate over a sufficiently large range of output. Second, huge capital investment needed in the case is to build factory or for R&D fund. Third, the exclusiveness right from patent. And the last, a few firms may own or control the entire supply of raw material required in producing product. Oligopolies usually prefer to compete on non-price competition such as product differentiation, advertising, and service rather than doing price war. Okay, that's all about the explanation about this case, and thank you for watching this video.